In this video, I want to talk about a very specific part of the Lucy Letby case, a part that over the last few days people have asked me about, and they've asked me if this is something that really happens in therapy. But first, let's set some boundaries and some caveats to this conversation. Firstly, although most of you know I work within the justice system, I work with offenders, I work with other people who are involved in the justice system, I don't claim to be a legal expert in any form. This video is purely focusing on therapy. Secondly, this video isn't intended to offend or to mean any disrespect to anyone who has been affected by this case. Something that was presented in the case and to the court were post-it notes of things Lucy had written down. And it appears that these were written between the time she had been suspended from duty and being arrested. And during this time, it's been said that she was distressed and she was anxious and she was told not to discuss the matter with colleagues or anyone else. So the counsellor told her to write down her thoughts and feelings on these notes as some form of therapy. So it appears this was on advice from her counsellor. So let's take a look at these notes to see what we are talking about. As you can see, it says, and I think these were the bits that were emphasised in court, I don't deserve to live, I killed them on purpose. I did this. I am evil, I did this. Hate myself. And then we can see there's other parts on the note, which to my knowledge weren't explicitly emphasised in court. I don't deserve to live. I killed them on purpose because I am not good enough to care for them. Not good enough. I can't breathe. I can't focus every day for that overwhelming fear. I'll panic. I haven't done anything wrong. Slander, discrimination, victimization, all getting too much. Hate myself. What was Lucy's account for writing this? She said, I wrote it because everything got on top of me. It was when I'd not long found out I'd been removed from the unit and they were telling me my practice might be wrong, that I needed to read all my competencies. My practice might not have been good enough. So I felt like people were blaming my practice, that I might have hurt them without knowing through my practice, and that made me feel guilty, and I just felt really isolated. I was blaming myself, but not because I'd done something, but because of the way people were making me feel. I'd only ever done my best for those babies, and then people were trying to say that my practice wasn't good, that I'd done something. I just couldn't cope, and I just did not want to be here anymore. I just felt it was all just spiraling out of control. I just didn't know how to feel about it, or what was going to happen, or what to do. Then the detective asks, what people were they? Letby replied, the trust and the staff on the unit. The detective says, did you ever make any mistakes? No, replied Letby. So the question is this something that a counsellor or a therapist might ask a client to do? Now, it would have been really helpful if the counsellor had been asked what their rationale was and if this was part of an exercise or a treatment plan. But from what I understand, the counsellor wasn't called to give evidence, and despite there being experts instructed, none were called, such as a forensic psychologist, to give evidence on how to interpret these notes. So, is there any basis to write down thoughts that might not be true or might not be based on real events? The short answer is yes. Let's consider someone experiencing generalized anxiety disorder, a key factor of which is excessive worrying. Now, this worrying can be something past orientated or something future orientated, and that includes situations that haven't happened in reality. If we take a look at some of the books that talk about how to treat this, and I'm specifically choosing evidence-based books here, books that are on reading lists for therapists on CBT training programs within the UK. So I can use books that have some validity. We can see it refers to something called imaginal exposure. So when is imaginal exposure used? Well, when someone has thoughts in their head that might be intrusive, they might be upsetting, they might be distressing, then in order to protect yourself from the pain of those thoughts, you may engage in something known as cognitive avoidance, which is a safety behaviour. In other words, when those thoughts or images show up, you do something to get rid of them, such as you distract yourself, or maybe you use alcohol, or maybe substances. And what happens then is that the person doesn't find out that upsetting thoughts and feelings aren't actually dangerous, and that the intensity of negative emotions naturally abates over time. So how do we combat cognitive avoidance? Well, we use something called written exposure. And what is the recommended scenario to write down? What is the recommended scenario that we expose ourselves to? Well, it's the worst case scenario. And the guidance says it's important to identify the worst case scenario driving these worries. Let's take a look at what we do in OCD, so obsessive compulsive disorder. We can do imaginal exposure, where you purposely think uncomfortable, fear-provoking thoughts and hold them in your mind until you become habituated and your distress diminishes. With this approach, you'll eventually be able to experience these thoughts without excessive discomfort. You'll feel less anxious when you have a bad thought and learn to accept such thoughts for what they are, just thoughts. Now remember, with OCD, most of the time the intrusive thoughts aren't thoughts of things that have really happened. So how would we do imaginal exposure in this case? Well, the first step, as we can see, is writing the narrative. So essentially writing out the thoughts that you're having in your head. So again, we would be writing down the thoughts without any basis of whether they are true to life or things that have actually happened. A case study example within this book is that of Robert, who had excessive concern he had harmed someone whilst driving. If he heard an unexpected noise or if he felt a bump, then he thought he had run someone over. This would play on his mind whilst he was driving, and he would end up turning the car around and returning to where he thought it happened to check that there was no one there, to check he hadn't harmed anyone, as he felt that what he had thought was enough evidence that he could have run someone over. So Robert engages in imaginal exposure, and he writes down thoughts of guilt, thoughts of shame, and going to prison for running someone over, even though he hasn't. And he writes it down in detail. He writes down about the bloody and mangled child he can see. And he does this as a way to reduce the distress of having those thoughts. Now, if you didn't know Robert and you didn't know he was going to therapy, and you just picked up what he had written down, this story of him or this narrative of him running a child over, you could quite easily think that it was something that had happened, because it's written in the present and in the first person. So I have done this. Okay, so that's generalized anxiety disorder and OCD. So they are very specific mental health diagnoses with very specific treatment plans. But we can see a connected process there, a connected process between these two anxiety disorders. This process of imaginal exposure and writing thoughts down. And these days we are heading into therapies based on those common processes. So a lot of therapists now will identify intrusive or distressing thoughts and images and then target them with strategies we know will work from the wider evidence base. So you don't need to have generalized anxiety disorder or OCDs for these strategies to be effective. And there's evidence of this being effective outside of therapy books. If we take a look at something like the effect of expressive writing on the error-related negativity among individuals of chronic worry by Schroeder et al., we can see that expressive writing influences the relationship between intrusive thoughts and further distress, such as the relationship is weakened. And even if we don't take all of that into account, how many of us that aren't mega geeks like me have heard about writing down thoughts to get them out of your head, to get some physical distance between you and your thoughts? It's an age-old technique. So there's lots of maybes here. Maybe this explains the content of what is written on that post-it note. Maybe the counsellor chose to give this as an intervention to try and help reduce distress. Without knowing what was said between the counsellor and Lucy, we aren't going to know. Let me know your thoughts about this in the comments. Have you ever engaged in imaginal exposure? Did it help you? Was it effective? Please let me know. What do you think about the use of it in this case? Take care, everyone. Goodbye.